During this video, we'll explain what's involved in a laparoscopic bowel resection. Bowel resection surgery involves removing the diseased parts of your small or large intestine. Laparoscopy is a type of surgical procedure that allows a surgeon to access the inside of the belly and pelvis without making large incisions in the skin. It's also known as keyhole or minimally invasive surgery. After anesthesia, you'll lie flat on your back on the operating table. Several small incisions or cuts, each no more than 1 inch wide, will be made in your belly. The number and location will vary depending on your personal requirements. One of them is usually next to your navel. An instrument called a trocar will be inserted through one of these incisions and into your abdomen. It has a spring-loaded mechanism that withdraws the sharp tip immediately after it passes through the abdominal wall. A short tube called a port is left in place to allow access to the inside of the belly. A gas, usually carbon dioxide, will then be inserted to expand your belly and help the surgical team view its contents more easily. Next, the laparoscope, which is a high-definition camera, is inserted. The images will be projected to a monitor for the whole team to view in real time. The inside of your abdomen is carefully examined. Then, a variable number of further ports are inserted through which a range of instruments can be passed. The surgeon will navigate towards the diseased area of bowel. They will examine it before making a cut in 2 places and removing the section in between. Where this is and the length of bowel removed will depend on your individual circumstances. If possible, the 2 healthy ends will be joined together using sutures or staples. If this is not safe, or the bowel needs to rest and recover for a period of time, the surgeon may need to bring the healthy end of your bowel through your abdominal wall and onto the surface of your skin. This is called a stoma. If the operation involves your large bowel, it's called a colostomy. If it involves your small bowel, it's called an ileostomy. The waste from your bowel will then pass out of the stoma and is collected in a bag that you wear over the stoma. Bowel contents will, therefore, not pass through your anus. A stoma can either be temporary or permanent, depending on the type of surgery you have and how much bowel your surgeon removes. The decision on whether to form a stoma or not will depend on what the surgeon finds during the procedure. Once satisfied that the procedure has been completed, the instruments and ports will be removed. The carbon dioxide gas is released. Occasionally, you may have a wound drain left in place. The incisions will be closed with sutures or skin staples and covered with dressings. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.